My name is Chris Burton. I'm the Principal Dental Surgeon at Middleton St George Dental Care. I have been here ever since I graduated, which was in 2005. I purchased the practice in 2008, so this has always been my practice. I just absolutely love working here and living in the local area. So our ethos at the practice is something called dental health for life. There's two parts to that. One is providing patients with treatment and treatment plans so that they have a functioning dentition for hopefully the rest of their life. For some patients that means dental implants, for some patients that means a hygienist visit every 6 months, and there's lots of patients in between. The second part of that is providing patients with a smile that they can be proud of and that they can eat, speak, socialise with. In other words, that they can get the most out of life. That's very, very important to us, as it is to our patients. Patients always have a comfortable, pain-free experience. Dentistry these days should not be painful. You should always be kept comfortable. Anaesthetics these days are absolutely wonderful. You should never experience any pain whilst you're in the chair, full stop. We believe that you should have a level of customer service that is personalised to you. Some patients need a lot of information presented in a certain way before they can make a decision about their care. Other patients need very little information and they make decisions very, very quickly, and it's very, very important identifying the patient's needs from that decision-making perspective. Predictable dentistry. We're not doing bleeding edge stuff here, we're doing cutting edge stuff sometimes, but everything that we do is evidence-based, science-based. We're not doing things which are risky, we're not doing things that are unpredictable, we're doing things that work, and that just brings a whole lot of pleasure and a whole lot of predictability for absolutely everybody. We are so thorough about it. You will get a medical history when you come to the practice, because we need to know everything about you from that point of view. You will also get a dental history as well, because we need to know more about your teeth than you do, and it's really good to have access to that information, and that is before we've even seen you. You will be examined very, very thoroughly, probably more thoroughly than you've been examined at most other places, if I'm honest, in 5 areas. The first is the health of your gum and bones. The second is concerns such as tooth decay, erosion, that kind of thing. The third is functional, so that's other types of tooth wear, so friction from teeth rubbing against each other, any problems with the joints, any dysfunction there. And the fourth is aesthetic concerns, if you have aesthetic concerns. If you don't, we don't need to do that. And the fifth is your risk of oral cancer as well. So you'll be assessed very, very thoroughly. We will then do a 3D digital intraoral scan of your teeth, which will stay on file forever. So at the very least, okay, we've got something that we can show you. We can show you exactly what's going on in your mouth. The other thing is that we can always refer back to it if anything changes in the future. And it's absolutely fantastic for monitoring any changes in tooth wear, tooth position, and anything like that. I've always thought that the day that I decide not to learn about dentistry anymore is the day that I should put my mirror and probe down and retire. It would be an absolute shame, because it is such an evolving field of science. And as the years go by and there's more and more research and evidence, it's just so important to be able to stay current with that, because then you know in the back of your mind, when you're making those clinical decisions, you're doing the best current treatment for that patient at that situation at that point in time.